We'll be covering the elbow joint today. We'll be referring to the right elbow, and we're going to view it anteriorly. If you follow the humerus down, it widens, and the widest portion is where you're contacting the epicondyles. We have a lateral epicondyle, and we have a medial epicondyle. The lateral portion is adjacent to the capitellum, which articulates with the radius. Here's our radial head, and the tubercle for the attachment of the bicep tendon. The medial portion receives the ulna with its coronoid process fitting in nicely like that. If you view this from the side, a coronoid process is here, and then we have our olecranon. Now, let's start by adding structures to stabilize this joint. Again, this is the lateral aspect, the medial. All hinged joints of the body have strap-like ligaments on either side to maintain stability and keep the joint on task with moving in one direction. We want to prevent valgus and varus motion. So we have the lateral, collateral, or radial collateral ligament, and we have the medial collateral ligament or ulnar collateral ligament. In addition to just medial fibers, there are posterior fibers, which we'll discuss as we evaluate this joint. Now, if you take your arm, palpate your medial epicondyle, move just distal to it, open and close your fist, you can feel the tightening of the tendon attachment here. And that just goes to show you that repetitive motion involving flexion of the fingers or even the wrist puts undue tension here if it's done often enough and long enough. That can cause a very local inflammation of the enthesis. It's an enthesopathy. And this one's called medial epicondylitis. If you want to test this to isolate whether tension on the tendons produces pain here, you have the patient cock their wrist, make a fist, and resist your attempt to straighten. Now, we'll just go right to the lateral epicondyle. Similarly, you can palpate just distal or on the epicondyle and extend your fingers and wrist, and that will put tension there. You can also radially deviate your wrist, and that'll also create motion there. So, in testing, you maintain the elbow in extension. Extend the wrist. You can have them make a fist, but try to overcome the patient's extension, and that'll put tension right at the lateral epicondyle. So that's how you identify these epicondylidities, fancy word. But back to our stabilizing ligaments. When you have a sprain, you want to evaluate, for example, the ulnar collateral by putting the elbow into kind of a valgus load. So that means you're going to put the heel of your hand on one side, right? You've got your thumb here, and your fingers are kind of curving here, and you're going to stabilize or use that as a fulcrum, and then pull back on the distal part of the forearm, creating a stretch there. And you want to find out if there's pain or if it's actually loose. So I'm putting my hand there at the joint line and loading it with valgus stress. Now I'm going to do the opposite and use my fingertips on the medial side of the joint and try to load with varus stress, testing the lateral collateral ligament. Okay? I'm going to go right now to the posterior fibers, which the Tommy Jones injury could be from repetitive tossing the basketball or pitching. Sometimes this is underdiagnosed. The test for this is the milk sign. If the patient can do it, it's to cross that affected arm over the opposite one, grab the thumb, and pull it down, and it loads right into those fibers. Sometimes you have somebody whose body habitus doesn't allow for them to do it themselves. You can do it yourself. Take your arm. Yeah, there we go. I'll do it. Yeah, so you can take the patient and load in. That's the milk sign. Other features of this joint to be considered are the radius itself. Now it has a ligament which wraps around, it's an annulus, and it holds the radius, the radial head, in position, relationship with the ulna. In children, most commonly, you can have a situation where a child is yanked by the arm, or you're holding the child's hand and they drop down to their bottom and they load into this area with extension and rotation, pronation, and it sublexes this radial head sort of out of the annulus. So this is called the nursemaid's elbow. Most often the elbow will be maintained in about 135 degrees of extension. It'll be pronated, and that's their position of comfort. These can be reduced if you get the child's cooperation. You can have them reach for something held up, something that they want to grab. What that's going to do is put them through a full range of pronation, supination, and extension. If you were to reduce it yourself, have a seat, please. The location of the radial head is right where this depression is. You can feel the joint line between the radius and the humerus.
Ulna? Ulna?
The ulna? That's on the opposite side.
Mm-hmm.
Yeah, so what we'll do is you want to put the child into full pronation and arc them into supination. And that will reseat that radial head back into the annulus. If it's relatively soon after the injury, the response is pretty dramatic. Going back to where that joint line is, that's where an effusion is located when you have the joint effusion. So if you're going to tap it, that's right where you would place the needle. I think that covers the elbow.
And that would be on the radial side. You would tap it if you're going to be doing it.
You would go right for where you feel that joint line?
Mm-hmm. In the back, posterior.
Yes.
So, and we're not talking about an olecranon bursitis. We're talking about truly tapping the joint, right?
Yes, yes. So in rheumatologic conditions, that's the most common presentation of an effusion there. You'd be right.
And that is on the ulnar side.
It's on the radial side. the
Radial
ulnar
side?
Yeah, can we redo the part where you're doing the nursemaid elbow too, since I said that ulna, I think it's going to be
A radius
but
side. The
yeah.
radial side, yes.
Yeah, I think I did the exact same thing that you're doing here.
Yep. Got it.
Let's reshoot that. Just the because everything up until that point is perfect, but then I said ulna, and I think I might confuse the residents.
Don't
I
confuse them.
Yeah, I think I may have messed